Here in the United States, we spend more than any other country on the planet. We spend $2.6 trillion a year, which comes to $8,000 per person per year, and it comes to 17.6% of the gross national product. And yet we're ranked 37th in the world. You might want to ask yourself the question, how could this happen that we spend more and get less? A lot of that is because medicine has become a business. It's not so much providing a service. It's not about listening and caring. It's about procedures, and it's about people inventing technologies and drugs so there can be a return on investment. One of the places where we spend too much money is on excessive testing. It's been estimated we spend up to $250 billion a year in unnecessary tests. It's interesting that Otis Brawley, a physician who is the chief medical officer for the American Cancer Society, has come out calling this medical gluttony. Dr. Brawley is an amazing guy. He works for an organization that I have little respect for because I think that they have so many conflicts of interest that they've lost their purpose. But this fellow, Dr. Brawley, has been outspoken for some time now, talking about tests that are done that are raising the cost of health care. They're leading to too many procedures and too many complications. They're probably done way in excess of what they should be done. So my hat's off to you, Dr. Brawley, particularly in that setting where last time you did this about a year ago, it took about 2 hours before you came out making a statement that we did too many tests, and you had to recant what you said because of the issues that came up, probably related to the conflicts between Big Pharma and the American Cancer Society. There are lots of medical conflicts of interest because doctors own a lot of the tests that they do. And that leads to doing more tests, and of course it's spending more money. We should be doing tests that are indicated because it's rational medicine, rather than being worried about having to ration care because everybody wants to do the test that they think is going to give them the best answers, whether it does or it doesn't. And that goes for coronary arteriograms, it goes for MRIs. You look at people who have had back pain, and very often they can be treated conservatively with physical therapy or acupuncture, chiropractic, all kinds of different body work, and a lot of the time they're winding up getting the MRIs, which could cost up to $3,000, rather than doing what can be done first. Now, there was a study done in the British Medical Journal in October of 2011 that showed that 50% of physicians who are in the setting of, or in the position of setting the clinical guidelines for diabetes and cholesterol had conflicts of interest. Now, these are people who are in professional medical societies that are actually setting the standards for these particular diseases and how they should be worked up. So it's come to a point where we can't even trust our medical professional societies for that reason. So defensive medicine is another thing that we would have to look at. Doctors don't want to get sued. They want to make sure they're doing what the state of the art is and make sure they're not making an oversight on something. So there's a tendency to protect themselves by doing more tests so that they don't wind up getting sued for something that maybe they could have looked into more deeply. So when we look at the cost of excessive medical testing, it comes to quite a number. You look at the $250 billion a year, that would be a good way to start cutting back on spending money that could be spent better at maybe trying to serve those 50 million people in the U.S. that didn't have health care coverage back in 2009, and now we've added 30 million of those into the Medicaid system. If we could pump that money into there, maybe the quality of care won't be slipping, and they'll be able to get the care that they deserve as well.